Myers.
Karan Patel.
Alyssa Dennis. Carla Diana.
Brad Gage.
Jerry Morris.
My name is Ashley.
Darren Lukeville.
Greg Gerston.
I am a student at a chiropractic college right now, 6 months from graduating.
I'm a student at Palmer College of Chiropractic in Florida.
I am from Atlanta, Georgia. I'm practicing with a CBP doctor down there. I just started associating in January with Dr. David Shapiro. So I've been in practice 14 years, Phoenix, Arizona.
I'm from Victoria, BC, Canada. I've been practicing about 14 years.
I'm from Hamilton, Ontario, Canada. Practicing since 1984.
Spokane, Washington, and I'm the head CA at Back in Motion Chiropractic.
I'm from Sydney, Australia. I've been practicing, it'll be 12 years at the end of this year, yeah.
I'm from Northbrook, Illinois, it's just outside of Chicago. I've been in practice for 13 years.
I came to school thinking that, we're gonna fix spines. And you take somebody, you see where they're at, and then we're gonna turn that spine back to normal. Well, you go to school and nobody really knows what normal is. And then they kind of just get stuck in the one phase of I got a pain here, that's where I'm gonna focus, and then that person comes back every week with that same pain right here, that's all they're ever focusing on. Well, why does that pain get better? The pain doesn't get better because you're not fixing the posture, you're not fixing the underlying cause of what's really going on.
Not many students know what normal is, what they need to do, and everything that Deed has taught us is defining what normal is first. Once you know what normal is, then you know what you need to fix, you need to correct, and that's the best part.
I've been to a lot of conferences in the past, and instructors generally are there and they're like, here's all of our information we want to give you, but we don't really have enough time to talk later, you guys aren't good enough. But here, everyone is so close, everyone's so just open to talk and take the time, and Dr. Deed is just unbelievable. He just really cares about each and every person and really wants everyone to get what CBP is about and really learn it rather than just get the general concept. So it's been so amazing. I'm definitely lucky to be here. I was drawn to this event just because I want to have a better understanding about CBP. My business partner has a better foundation. He's been to this particular seminar, and now it's my turn. The most favorite thing I think of coming out of it is going to be that the instructors stay after. So you're talking 9 to 7. As if that's not long enough, then they stay after if you have questions. So one time it was till 8:30 another night, and we're talking 7 days in a row. So it says a lot for the instructors and showing that they really are here not for any other reason but to help us become better, to help other people, serve other people.
Well, that would probably be about 5 years ago or so is when I first got my first taste for CBP. In some ways it's changed everything for me. I really felt like I was suddenly learning the things in a way that answered a lot of questions for me. I think I knew a fair amount about some things but then didn't realize what I didn't know. And it wasn't until I actually started to dig deeper into it with CBP that I realized how much that I didn't know and how much that I hadn't been taught in school and how much I hadn't, experienced in my post-grad work. And so it wasn't until I really started to dig into CBP that I realized there was this whole other level that you could go to as far as your understanding of what we do. CBP has really helped fill in a lot of those gaps for me, and so now I feel even more confident in what we do, both in practice myself, but also as a profession.
I first heard about CBP about 10 years ago in Montreal, where I met Don Harrison. It's changed my practice because I got tired of just helping people rot quietly. When you walk in, within an hour you feel like you're part of a family. It feels like everybody's here for the same purpose. You're not here for any other purpose but to just make your practice better, to make each other better, and to really support each other in your growth, but by getting the result for the people who came to trust you.
I've actually been studying CBP and listening to Deed for the last 8 years, so I already know the quality of the information. I also have seen it in my practice, how it changes people's lives. And certainly also when you have a difficult case, a spine that has some significant problems, traditional chiropractic's not going to change that. So the CBP really makes a difference with those people.
So I actually studied CBP when I was in school. Went to a cervical spine seminar about a year ago, and then started implementing some of the things that I learned, and just started kind of falling down a rabbit hole of just information that made sense and produced patient outcomes and helped the practice grow. It's a patient I've been working with for 5 years. She's a wonderful person. She's a teacher, and when she came in, she was complaining of some abdominal spasmings that she just couldn't explain. Over the last year, she was having a lot of troubles with figuring it out and kind of scared about it. At the beginning of the year, we took some more updated images and x-rays, and I evaluated them the way I'd been learning to with CBP. We started to introduce some changes. She shared with me she was going on a vacation of a lifetime. She was going to Hawaii, and her whole family was going, and she was concerned that she wasn't going to be able to enjoy it. So we started to do some of the tractioning that I learned from reading the textbooks as well as at that seminar, and within a couple of days she had her first hour of no spasming. It was pretty cool.
Dr. Deed makes a difficult concept easy to understand. He's got a likable personality, a sweet personality, to where you're not offended ever. You don't feel as if he has any agendas. He is basically here to serve all of us to become, so he can get his knowledge that he's put so much time into. I mean, it's just unreal. I would never want to do what he does. Thank goodness there's people that are like him, that he has a passion for that. You know, whereas me, I'm more hands-on, you know, and so I don't enjoy doing research. I don't enjoy all that, and I'm so grateful that he is doing it for us. So, very much appreciated.
Guys, let me tell you, if you are uncertain about what your path is in chiropractic, I know I just graduated, and really up until 6 months before graduation, I knew chiropractic worked, but there was not really a concrete reason why. And it frustrated me because, you know, people would come to the chiropractor for years and get temporary relief but never see long-term results. And it really frustrated me because I was like, you know, we're adjusting them this way, it should increase their curve, it should make them look their posture better, but realistically it's not. So if you want something that will really honestly change people's lives in the long term, you need to come check this out. It's amazing, you'll be so inspired. Everything is scientific, research based, it makes sense. So definitely come out.
Continuing ed is a great opportunity. You need the hours anyways. Check it out, right? You get more than you need. Some states you can get 2 years put all into one. And the way Deeds presents it, it's information that is not too far out there to actually put in a practical sense and actually make the results happen. Where some people say, oh, CBP, it's too difficult, I don't want to learn it, I'm too intimidated. There's none of that reason anymore because of the way that the instructors teach it. They're very, very skilled, and they put a tremendous amount of time in. Give them a chance, even if you just come to one, make a decision for yourself. But I can't emphasize enough how important it is to give it a try, and I'll definitely be back myself because I want to go to the scoliosis seminar next. So I'm a fan.
Hey everyone, it's Adrian from Denarol and Don Meyer from Circular Traction.
Hello.
I just want to say thank you to everyone for their support, and we thoroughly enjoy coming over here and learning ourselves and sharing what we know, and it's just great to see everyone's enthusiasm and encouragement, not just from the people attending but even from our colleagues as well. So Don Meyer from Circular Traction, he's a legend in the game, and he's helped me grow from just being the Denarol guy towards a better CBP doc myself. So yes, thank you to everyone's energy.
Thank you. That's nice to say. Thank you. Thank you very much.